Should I go to work or should my kids go to school if either one of us are sick?
This is easy. The answer is no. The best thing you can do is protect other people. So if you have a flu-like illness this fall, you should definitely stay away from work or stay away from school until you are no longer contagious. When is this? CDC and the other public health folks recommend that 24 hours after your fever has resolved. So in other words, if your child has a fever on Thursday evening, but they wake up Friday morning feeling fine, you should not send them to school. 24 hours has not elapsed yet.
Should I go to the hospital or a clinic if I think I have the H1N1 virus?
This is an important question. If you have mild to moderate symptoms, I recommend not. And this is really for two reasons. One is because there's not much they can probably do for you there anyway. And two is the lines may be very long and it may be very crowded because lots of other folks who are sicker may already be there. On the other hand, if you are pregnant or you have a high-risk medical condition or you have symptoms consistent with severe disease, such as severe shortness of breath or chest pain, or you think you may have developed pneumonia, then that's the appropriate thing to do and you should contact your medical provider.
What about women who are pregnant?
This is an important group because at this point there's evidence both from the U.S. and in other countries that women who are pregnant and their babies are at higher risk for severe outcomes if they are infected by influenza. So this means several things. First, those women should be first in line with the flu vaccine. The pandemic vaccine becomes available. I should add that you should also get the seasonal flu vaccine if you are pregnant, and that's becoming available right about now. So it's important that you do both those things. Second, you should contact your healthcare provider if you think you have flu-like symptoms because you may be a candidate for Tamiflu or other anti-flu medications early on in the illness, even before testing comes back. And this probably applies to people with other chronic diseases as well.
What about vaccination?
Yes, several key points about this. First, the regular or seasonal flu vaccine is currently available, and I do recommend it, especially for high-risk groups. Other folks may want it as well, because regular flu viruses may also be circulating this year, and this is the best way to protect yourself. Second, the U.S. government has commissioned pandemic vaccines, so a special extra vaccine for this year, specific against the H1N1 or swine flu virus. Unfortunately, it is not available yet. First doses are expected probably in mid-October. It's also important to know that it will probably take at least 2 doses of vaccine to give a person immunity, which is a little different from usual. I'm also often asked, can you get the flu from the flu vaccine? And the answer is no. The flu shot is a killed virus. It cannot give you the flu. About the worst it can do is make you achy for a few days. That's generally a good thing, because that's your immune system actually making antibodies that will protect you in case you get exposed.
Are there any special recommendations for schools?
Yes, there certainly are. There are 8, in fact. 1, schools should monitor absenteeism on a daily basis. Prompt recognition of an outbreak is important so that the least disruptive measures can be implemented to limit the spread of disease. 2, schools should pre-identify high-risk students, especially those who are pregnant or have a serious chronic disease, and make sure they are in close contact with their medical provider. 3, make sure that everyone knows what a flu-like illness is. At a minimum, it's a new fever and either a cough or sore throat. 4, remind everyone about hand washing, using hand sanitizer, and keeping their fingers away from their eyes, nose, and mouth. 5, quickly identify any students or staff who are sick at school, separate them from others, and send them home promptly. It is appropriate to provide a mask for the sick individual if they can tolerate it. 6, staff who provide care for sick individuals should also wear a mask. 7, ensure that students and staff with the flu stay at home until their fever has been gone for at least 24 hours. This does not mean that parents should load their kids up with Tylenol or Motrin, declare them fever-free, and return them to school. 8, work with local or state health departments to discuss options in the event that school closure may be required. Any decisions should balance the risks of keeping students in school with the social disruption that school dismissal can cause.
Will schools close?
There was substantial confusion about this last spring, as you may recall. Some schools closed, some didn't. Some districts were really confused and weren't sure how to proceed. At this point, public health authorities are generally recommending that schools remain open. And this is really for several reasons. First, overall, the virus does not appear to be severe enough to warrant such an extreme measure. 2, By the time you think about closing the school, often most people have already been infected or exposed, and it doesn't actually help you that much. And 3, closing schools, unless you absolutely have to, is highly disruptive for students, for parents, for teachers, and for other places where those parents and other folks work.
How can people prepare at home?
Well, what else to do? As I said, if you have children yourself, it's worth planning about a week's worth of educational activities, just in case. Make sure your internet bill is paid so you don't lose access. Make sure your contact information at schools, daycares, work is up to date, so you can call folks if you need to call in for stuff and so they know how to reach you. Buy alcohol-based hand sanitizer, at least 60% strength, and don't be afraid to use it. One question I sometimes get is hand sanitizer safe? And the answer is yes. We recently completed 3 years of work in 10 elementary schools in Pittsburgh with thousands of children using it every day during flu season without a snag. Like any over-the-counter product, if you eat it, it can make you feel sick, so be careful around toddlers and younger kids who tend to put their fingers in their mouths.
Should I go to church or other social functions and indoor events where there are a lot of other people around?
It's very important to protect others. If you are the person who is sick, you should not attend functions where you may infect others. We recommend that you self-isolate as much as practical until your fever is gone for 24 hours.
Can I still use mass transit?
Again, if you are sick, we recommend either trying to find an alternate method of transportation or, if that's your only method, to wear a basic mask. If you are not sick, there's no recommendations currently to avoid mass transit.
And what about international travel this fall and winter?
It's unlikely that airline flights will be closed or changed much in any particular way, but it is important to know that some countries may have very restrictive policies about what they do if they think you are sick. So it's important to check that in advance, because there's always a chance that if they think you have a fever or an illness, they may pull you aside and they may isolate or quarantine you, and this may ruin your expedition.
Well, thank you very much, Dr. Stebbins, for this important and timely information about the H1N1 virus, and thank you for watching. If you have any questions that weren't answered today, please feel free to email them to us at upcphp@pitt.edu. As the H1N1 situation evolves throughout the school year, we will post updates on our website and provide information to answer your questions. Our website is www.prepare.pitt.edu.
Thank you.